All right, everybody, this is the first Ask Me Anything AMA. I've got my co-host, Justin Edelman. And since you haven't met Justin before, I'm going to let Justin answer the first question I ask everybody. How did you get where you're at knowing what you know? And then Justin's going to take over asking me questions.
Well, thanks for having me on the podcast. Excited for my debut. I always wanted to do the thing where you say long-time listener, first-time caller. So I'm the head of product at Bionic Health, and I spend most of my time focused on what makes our members successful, what makes our doctors successful, and how can we build great tools for them. I met Jared at his first startup, solving the medical documentation problem for doctors, helping to build iScribes and then DAX, and doing that through Nuance and Microsoft. And super excited. This has been amazingly fun and a great way to kind of feel like we're making outcomes for members in a really direct way. So I'm also pumped about this AMA. Gives us a chance to learn a little bit more about Jared, a little bit more about the background, and we do get common questions from you guys. So maybe we'll get started there. So first up, the podcast is titled Medicine 3.0. What does that mean, Jared?
Yeah, it's a funny name. I would say most of the population doesn't know what it means. The people who know what it means know what it means. So it's a little bit of one of those like wink, wink. If you found this and it's Medicine 3.0 and you know what it means, then you know what you're looking for. So let me explain for those who don't. I don't want everybody to feel like they're outside the cool kid group. So I'm going to explain and everybody can be in the cool kid group. So Medicine 3.0 is a term that's been around for actually a while, but it has been popularized in the last 3-4 years by Dr. Peter Attia in Texas. And the way he talks about it is the transformation of reactive medicine that learned how to use science, medicine that gives good treatment today, to becoming proactive, personalized, precision-oriented medicine. And so this is thinking about risk in a different way. It is thinking about health instead of illness. Of course, still taking into account illness and that we will all become ill someday, but it's how do we help you stay as healthy as possible for as long as possible and disease-free as much as possible. So it's really a completely different lens, and it doesn't honestly work very well in our healthcare today because healthcare isn't built for this. And some people will say like doctors don't know how to do it. And it's partly true in that they would need some extra training, but doctors are very intelligent people and it's not that hard to deliver Medicine 3.0. They just haven't had the tools or the framework to do it in the past. And so Medicine 3.0, think of it as great medical care and great healthcare. Like not just treating your illnesses, but helping you stay healthy. So that means fitness, nutrition, cancer screening, sleep, all the most important things.
Awesome. So it sounds like you were, focused on emergency medicine when you got your start. Medicine 3.0 in a lot of ways sounds like a completely new philosophy to be proactive. How did you get interested in the space? And what did you learn as you were kind of getting up to speed?
Yeah, it is completely opposite. Medicine, emergency medicine is like the example of Medicine 2.0. And what is cool about the US health system is we are the best in the world at acute care. Meaning if you have an emergency, the US health system is amazingly good at those things. If you have a heart attack, we can get you to the cath lab in under half hour and we'll open up that blood vessel and amazing. We saved your life, but often with like downstream effects. And being in the ER, I loved it. But I'll tell a quick story that kind of shows some of what I hated about being in the ER. So I was taking care of a woman in a small town and she just came in with a cough. And so I got a chest x-ray and I found a mass on the left side of her chest. And this is a woman that honestly should have been getting screened. She was a smoker, so she should have been getting screened for lung cancer. And I diagnosed her with lung cancer that day. And what she said to me is she starts crying and she says, I just came from my friend's funeral. He was here a month ago and he got diagnosed with lung cancer. And I went to his funeral today. And I looked at her and I was like, don't worry, you're not going to be dead in a month. And as my bad luck would have it, a month later, she came into my ER and I was there when she died. And not only was it heartbreaking, but it was such a good illustration of how medicine, the type of medicine that I was a part of, was failing people when, if she had been appropriately screened, that cancer could have been caught when it was stage 1 and she could have been cured. And so Medicine 3.0 is completely different in that it takes up that mantle of saying, okay, as a caregiver, I'm going to own this piece of work that has been ignored, helping you screen the best you can, helping you be smart about your nutrition and your exercise, and helping you plan for the future. Doctors just don't have the time to do that work today. It's not something they get paid for. And it's not something that is built into our insurance in the way that it really needs to be. So that's kind of part of where my interest came from, was got tired of being the person kind of catching things too late. And how I got introduced was really through kind of my continuing medical education. I'd always been a listener of education. And it's funny, I was kind of early on that, where in my residency, 2008 to 2011, there are kind of two big books for emergency medicine. One of them is called Tintinelli. It's written by a UNC professor. It's this giant book of emergency medicine. And I was told that I was supposed to read that like 5 times during my residency. But what I figured out pretty quickly is that it was outdated. Like, it was published as a hard copy. It was outdated the day it was published. And so I've always been somebody who wants to learn like the most up to date. So I started listening to a program called EM-RAP, which comes out of University of Southern California. And then I listened to MCRIT, a podcast out of New York City with an intensive care emergency medicine physician. And I kind of got on the bandwagon of, I want to be up to date with the latest science, always, in whatever kind of medical care I give. And so it started way back then that I would kind of educate myself in people who are leading the way and looking at the science. And so it was pretty natural for me as kind of it got more popular around preventative medicine. And there have been people like Mark Hyman or Dr. Weil down at University of Arizona. They're a little bit more like functional medicine, meaning that some of what they do maybe doesn't have all the science behind it yet. And I know that might hurt some functional medicine providers' feelings, and it doesn't mean that it won't be proved out what they do. And so by no means am I trying to say anything bad about what they do. I think that there are some great providers out there. But the way I think about Medicine 3.0 is very science-based. It means that you say where you do know where the science supports what you're doing, and you say where you don't know. And you have to make assumptions, because science, we don't have science for everything. In fact, most of what a doctor does today isn't necessarily science-backed with randomized control trials. It's backed with cohort studies or other types of anecdotes or things that they've seen in their life or things they were taught by their professor. And so really learning Medicine 3.0, there is no specialty for this. There is no fellowship for this, although I dug in with different, lifestyle medicine or American Academy of Anti-Aging, and some of them have really good education platforms, but they're education businesses. And in the end, they don't always have the most up-to-date best science. And so while it's not easy to kind of gather all the information yourself and synthesize it and put it together, that is actually the work that has to be done by the provider. And then as part of starting Bionic Health, I've put that together and tried to make that easy for our other physicians as they join, is that they can catch up and they can learn how to practice Medicine 3.0 in a relatively easy, fast fashion. They don't have to actually go back through all the science and through all the education that I did, because I can kind of point them in the right direction to get trained up in this type of medicine.
Awesome. I'm glad we're getting to the spicier part of the pod here. Did you have any previous beliefs that changed? Anything that surprised you as you got into this space?
I was surprised that there wasn't better like training out there. You would assume that there would be training in this field. And there are trainings, like I mentioned, there are all sorts of trainings. And I'll just give an example of where it's problematic with the trainings that are out there. So one example is peptides. Peptides are a huge deal right now. You'll hear about them on podcasts, and people call us and ask us, do you prescribe peptides? And the answer is absolutely yes, if you understand what a peptide is. Now, a peptide is a protein. And so pretty much any drug that is like made up of protein is a peptide. And so like semaglutide or tirzepatide, those are peptides. Insulin is a peptide. So yes, we prescribe peptides, but there are these other peptides, and many of them are failed drugs or orphan drugs, meaning they didn't make it all the way through the FDA pipeline to be real drugs, like carried by all the pharmacies out there. But they're brought to market as kind of, in the past, they were brought to market under this kind of loophole. And so some of these are really pretty powerful substances that do things in your body. And so the pharmacies and the peptide companies that are out there are incentivized to sell these. And so they build education around it. And so if you go to some of the anti-aging or other types of trainings, what you might find is you're going to get trained a lot on how good peptides are. And like I said, there are great peptides. There are life-saving peptides. But some of these peptides are actually dangerous. And so understanding the incentives behind the education is really, really important. And it was surprising to me that there wasn't kind of an educational source out there that I could sign up for and that I could learn. Now, I will say, I think the best educational source out there for a physician who wants to do this is probably what Peter Attia put out on early medical. And early medical is a beast. It is something you sign up for, and it's meant to be kind of taking you through the experience of being Peter Attia's patient. I imagine it's not quite like it's presented on early medical, because most of Peter Attia's customers, patients, members are extremely wealthy. And I can't imagine them spending all the time it takes to go through early medical. And even Peter Attia has said that most or many of the people who sign up are physicians who are trying to learn more about practicing this type of medicine. I'd say that's the best place to go formally get trained. It's not going to give you everything you need, but it's a really good start. So I'd say that is the biggest surprise to me, is that there's not more out there. I think it's growing. There's the Healthy Longevity Medical Society, which I'm part of, which is an international society. And we do case sharing with that society, and it's really cool. I mean, you have people from around the world sharing how they're helping do longevity medicine. And so that was surprising too, that there wasn't something. It was when I started Bionic Health, the HLMS just started. And so it's very young, kind of specialty longevity medicine 3.0.
Super interesting. So you talked a little bit about the category and the concepts. Let's make it a little bit more personal. What does longevity mean for you personally? What does that look like as you get closer and closer to 60 years old?
I am closer today than I was yesterday. Justin's been with me for a long time. He was there when we had a coworker, and I was the boss. Remember, I was the boss, and he asked me if I was turning 50, and I think I was turning 35. And so yes, I'm not as close to 60 as some people, but I am aging daily. And so what longevity looks like to me is really what we talk about, health span. And, is the idea of concentrating morbidity, which just means concentrating illness to as short and a little part of your life as possible. It was first thought of by a professor at Stanford, I think back in the 70s. And he came up with the idea of this compressed morbidity, compressed illness in your life. And the whole idea is you don't want to like go down at age 60 and go for another 30 years. You want to go until like maybe 80 and fall off a cliff and be dead like 2 weeks later. Like that would be ideal, to live as healthy, meaning this is kind of your level of health. And if it goes down really slowly for a really long time, or if it drops and then goes along the bottom of that axis of health, then that sounds terrible to me. And so what I want to do with my life, and what I try to help our members do, is optimize to keep their health as high as possible, as long as possible. And what's interesting is it's honestly not that complicated, but it is difficult. And it's convincing people that they have to lift weights and exercise and keep moving their bodies and not eat too much food. And yes, there are some pharmacy, like some drugs that we might use in there. But for the most part, it's a lot of like habit change and helping you live a healthy life, which our modern society is kind of set up against. That's how I think about longevity: as healthy as possible for as long as possible.
Yep. It's been one of the most interesting parts for me, kind of digging in with our members and seeing them. Everybody's got their personal healthcare journey, and hearing a lot of our members define it as they want to do their favorite hobbies now and when they get older and with their grandkids. What are your kind of personal favorite hobbies right now?
I like to rock climb. My daughter is a competitive rock climber, and so she has passed me, like doubled my skill in that now, which is sad. But my son, he just started climbing with me, and we are the same level. And so it'll take him at least 2 weeks to be twice as good as me. I like that. I really like to work out now. I mean, I've worked out. It took me years and years to make it a habit. And I kind of tell people, like, it's all about consistency. And one of my favorite things is I was talking to our advisor, Abby Smith-Ryan, who's an exercise scientist. And when I asked her, what do you do for exercise? She said, it doesn't really matter that much what I do. It just matters that I'm consistent. And it's one of those things, like, if people will just be consistent day after day, just make sure you do something day after day, then you're going to see progress. And so like exercise is a big part of my life. And most of my hobbies are either around my kids or around exercise. I do have a boat. I love to wake surf, but I'm not that great. And I wakeboard once a year until I get injured. And it usually just takes that one time every year for me to remember. I haven't seen you out wakeboarding this year. When am I going to see you jumping wakes, Justin?
Maybe soon.
Yeah.
We'll see. There's some summer left, especially in North Carolina. So
yeah. Well, I want to see you send in some big jumps. For those who don't know, Justin is a pretty good wakeboarder. He did it with the club team at UNC, and he's got some good air across the wake, but also just some amazing wrecks. And I love those because they make me laugh.
Yeah.
But yeah, I'm looking forward to it.
Yeah. The best part about a big wipeout, yard sale, everything everywhere, is hitting the water, and then your ears get over the water and you can hear Jared laughing as the boat is like in the distance. So that's the best part.
It's true.
So a question that we get a lot, right, is why should younger people care about this? How do you think about that for younger people?
Yeah, I think there's a few things. I think one, it's important to just screen for certain things. So like lipoprotein little a, which is 6 times as bad for your blood vessels as LDL, like get screened when you're young, so that you can eventually, when we have the drug, which is in stage 3 trials right now, eventually you're able to get put on that so that your risk of a heart attack isn't double that of the rest of the population. I also think it's helpful to like know what your hormone levels are when you're young. Like when you're healthy, like let's find out what your testosterone, if you're a female, what your estrogen, progesterone, testosterone, like let's learn those things about you when you're young. The next part is there are a lot of young people who aren't crushing it in their like health. So that they might already have some cholesterol issues. They might have some issues with their joints. They might have some issues with carrying around a little bit too much fat on their body. And so those are all things that we're expert at helping people with and helping them make those changes. So I think there are plenty of healthy young people that hit the gym and work out hard. And for those people, I'd say, let's at least get some basic labs and do some screenings for you. And then for those who need to make habit change, then that's exactly what we help you do.
Yep. I love that concept from you that, I hear a lot is progress, not perfection. Mm-hmm. And it almost doesn't matter where you are today, right? You want to set a baseline and then you want to change habits and improve. So I think that's super helpful. Maybe let's make it a little bit more concrete. So we'll go like 30s, 40s, 50s, 60s, 70s. How do you think about those different decades and what's, more important, or is there a pivotal time across the decades of life?
Well, I think you have different risks during different decades. So your risk of death from an accident is kind of your highest risk of death in your 20s. So let's make sure you're not dumb. Like, let's make sure if you're going to drink, you drink responsibly. You don't drink on boats out by yourself. You don't drink and drive, those types of things. Let's also do some screening at that age. And then let's start working on healthy habits and put in that kind of foundational things that you need for the long term. In your 30s, you do start to slow down. In your mid 30s, for both men and women, you start to have some body changes. And a lot of that is just you're not moving as much. You're not naturally moving as much. And what people don't realize is a lot of the kind of tapping your toes, moving your legs, those things decrease over time. And you don't realize how many calories a day those things are burning. And so you'll just gradually start changing your body. And what you really have to be careful of during your 30s is don't let it get too out of control. So if you get to a point where your muscle mass is really low and your fat levels are really high and you're in your 30s, like let's tackle that because it's going to only get harder as you age to get through that. And then in your 30s, if you have a strong family history of some cancers, that's when we want to start looking. There are people in their 30s who die from colon cancer and breast cancer, lung cancer. Like, let's go ahead and do some things to look at that. And then let's also understand your genetic risks. Do you have ApoE44? Do you have a risk for Alzheimer's that's higher than the general population? Like, let's look at those things so that we can start testing, tracking, and making sure that we keep you healthy past your 30s. And then in your 40s, you're really getting to a point where cancer is becoming very important for you and vascular health. Now, we did those screenings in your 20s and your 30s so that if you had cancer or vascular problems, we already took care of them. But if you're joining us in your 40s, you're kind of behind the eight ball now, where we need to get on top of those things. So really understanding, how do we screen you for cancer? We have technology today that I would argue, if you're willing to spend $3,000 a year on cancer screening, then you probably, and I'll say this with like pretty high certitude, you probably won't die of cancer because we'll catch it when it's stage 1. And so those are tests like the liquid biopsy from the Gallery test from Grail. That's full body MRI. That's making sure you get your colonoscopies, your skin checks, your low dose CT scans, all those things. You can do that for around $3,000 a year and guarantee yourself that you won't die of cancer, it's cool that we live in a day and age when that is possible. It's not something that, everybody can afford. And I realize that it is a place of privilege for those who can afford it. But if you're going to spend your money, it's a good place to spend your money. And then I'll go up to 50s. In your 50s, again, if you're just joining somebody like Bionic Health, if you're joining us, then we really got to get to work. We're looking at adding as much muscle as possible. So, and you can almost think like when you buy a product and it's like this plus this plus this and this, it's really like that. We want to do all the things from your 20s, 30s, 40s, and now we're going to do even more in your 50s. And so looking at how do we help you add as much muscle as possible, making sure that you're metabolically healthy. And these are things that we hopefully did in your 30s and 40s as well. And really putting yourself in a good place. Now, the cool thing is our bodies are tremendously resilient. And really, up till about age 55, I would say, most of us haven't done too much damage to our bodies. Now, there are plenty of people that have a heart attack before 55. There are people who have a heart attack in their 30s. So yes, you should start earlier. But if you get to your 50s, and I don't want you to think it's too late. Like, there's so many good things. And I even say this to my 85-year-old mom. It's not too late to get stronger. Like, doing those squats and walking those stairs, like, that's really great. And you can keep getting stronger. And so that's really how I think about starting from 30s up to 50s, and then 50s, it just continues on, proper cancer screening, proper vascular screening, getting good sleep, nutrition, exercise, making sure that foundation is good. And you need somebody to help with that because, one, while it is easy, it can be very complicated. And there's so many voices out there telling you what to do. And two, it's something that you need help with usually to get the motivation to make the change. Not most people are self-motivated enough that we can just give them a plan, give them a book, and they're going to go do it. Like, that's why we have coaches. That's why we have people that help us do these things.
Yep. I mean, one thing I like about our members, right? We've got this big age range, and everybody comes in with their own reason. You see the younger generation being more health conscious from the start, right? You look at something even like, there was one non-alcoholic beer option for a long time, and now there are a bunch of good ones, right?
Yeah.
So I think that's interesting. And, whether it's like you're thinking about fertility early, or maybe you've been a parent and things have slipped, or, everybody has their own events and things that get them going. So I love that about our service, that it kind of works for no matter how you're coming in. Do you have a favorite member outcome for Bionic Health members? Something you've helped someone with?
I mean, there are so many. Whether it's catching cancer early or seeing somebody kind of completely do a recomposition of their body. We have one member who's lost nearly 100 pounds and his visceral adipose tissue has gone down like crazy. And now he's adding muscle and seeing like he added so many years of health to his life, and good movement in his life. So there are a lot, just like hormone screening, we were able to help somebody who had early ovarian failure and just things that wouldn't have been caught. And she also had some osteopenia. And so she was going to go without estrogen. She had an IUD, so she's going to go without estrogen for even longer and probably would have had worse bone. And so being able to get her on hormones and make sure that she's well taken care of, like it's interesting because we'll have people come in and they'll look like the picture of health. But once you look under the hood, almost nobody is truly the picture of health. Like, everybody has something to work on that can make them healthier.
Changing topics a little bit. I think the previous podcast, right, at least while we're filming this, the most recent one to be released with Zach Cohane, I think it was an amazing podcast. It talks about some of the great success stories for AI in medicine. And a question that we get is, how is AI playing a role at Bionic Health? Can you speak to that a little bit?
Yeah, I mean, AI, it's interesting. We often think about like features in our technology, and all our members really care about are benefits. And so the features of AI at Bionic Health is clinical decision support and helping us respond faster to members and helping us build out reports easier and faster. And so those are like the features. But the benefit for our members is they get like one-on-one time with the doctor for an hour at a time, and they get really good understanding of their medical situation by the physician, who was able to do that way faster because of the tools that we have. And so really when I think about the benefits that our members receive is they just receive such better care, and it's really precise to them as an individual, which for the most part, because regular healthcare doesn't really have AI built into it all over yet, they can't deliver those kinds of benefits.
All right, let's get to some other common questions. So supplements are a big topic. A lot of the big podcasts are having these frequent episodes, right, all around supplements and what this person is taking or that person is taking. And I think all of us too, to some extent, we do some habit or we take something and we're like, is this thing working? Should I be doing this thing? How do I know if a supplement is working, and why do supplements work for some and not others?
I mean, the second part of that question, why do supplements work for some and not others, is a great question. And I think a big part of it is placebo effect. Now, when I say placebo effect, some people may think that I'm saying it's because it's not working. But what you have to understand about placebo effect, the reason we have to do randomized controlled trials is because placebo effect is real and it works, which is awesome. What that means is if you believe something is going to do something good for you, your body will actually change and make it do that good thing for you. And so that's why we use placebos, so that we can say, okay, with a placebo that I think is going to lower my cholesterol, my body actually does lower its cholesterol by this much. But when I take a drug, it lowers it by this much. And then we prove that difference, that delta, and that's how we get drugs approved. And so when you look at supplements, I think a big reason supplements work for people is because of placebo effect. Now, when you're talking about specific supplements, I like supplements that I can track what they're doing in your body. So I'll give you some examples of these. Like, I like omega fatty acids because I can look at your red blood cell membrane and see the levels in there. And then I can look at cohort studies that tell me things about omega fatty acids and how good they are for your brain and your heart. And I like vitamin D because I can check a level. So I don't just tell you to take 1,000 IU a day. I tell you to take it and I recheck. And if I need to, I bump up your level of vitamin D so we can get you to a point we want. I like CoQ10 because we can recheck levels and see where we get you. I like creatine because it has so much data behind it. And I can actually see it in your urine and in your blood work if you're taking creatine and if it's being converted to creatinine. So I really like supplements I can track and that I can measure. The other part is how to think about supplements is that you should always think about supplements as one of the least important things. And I think people like to talk about supplements. Remember incentives. I talked about this when I talked about peptides. Like, why are people incentivized to talk about peptides? Because they're selling them. Why are people incentivized to talk about supplements? Because many of them are selling them. And so there's reasons to talk about supplements. It doesn't mean that I don't believe that supplements do things for people or that they don't work. Many of them are powerful like drugs. But I think it's important to understand like why people like to talk about supplements. The number 2 reason people like to talk about supplements is taking a supplement is much easier than working out or eating right or sleeping right. And then sometimes taking a supplement, we hope benefits those things. You know, I hope that creatine helps me work out longer and harder. And if Magtine worked for me, magnesium threonate, which it doesn't for my sleep, then I would take it and hope that it helped me sleep better. And then I think a lot of it is N of 1 experiments, meaning experiments for yourself. And so one, understanding, is a supplement safe or not? Why am I taking it? What is the outcome I'm hoping to get? What is the risk? And then two, is it working? So you take it and you see, is it working? So for example, I might have my LFTs, my liver function tests, AST, ALT. They might be a little bit elevated. And it might be something that I want to try N-acetylcysteine and glycine, because those two amino acids are going to come together to make glutathione, and it might help my liver function a little better. It might clean out toxins from my liver a little better. So I would start those supplements, and then I would recheck my liver function test and see, did it help? So that's kind of how I like to think about supplements. Like, can I track it? Can I actually see if it's working? And then actually do that, track it and see if it's working.
Great. I think that's super helpful context. All right. So a question that we get a lot, right? Bionic Health is sort of in this new medicine 3.0 category. There are other places out there that you can get sort of in the medicine 3.0 space. What makes Bionic Health different from something like Function Health or some of the other options that are out there?
Yeah, I would say it is the whole package. Like Function Health, Dr. Hyman, I love Dr. Hyman. He is also a great salesperson, but he does a lot of good. He sells a lot of product, but he does a lot of good. And you can do both in this world, because obviously I want people to buy Bionic Health. But Bionic Health has everything in it that you need. Like, it has the doctor, it has the testing, it has the wearable data, it has the education, it has the coach. It just, like, the complete package of what you would expect from like a really high level concierge doctor, and we're extremely well trained. So Function Health, you can spend $500 and get a ton of labs, and on the report, they're all going to say, go talk to your PCP. And if you think your PCP, who has 15 minutes a year to talk with you, is going to review those, I can't remember how many biomarkers, 250 biomarkers, and give you an opinion, then you're probably wrong. Like, your PCP is going to be pretty frustrated and say, I'm sorry, I don't have time to do this and go over this with you. So while Function gives you the opportunity to order labs, I kind of think of it as e-commerce for functional labs. And then you've got our other competitors out there. And let me be clear, like, anybody working in this space, I absolutely love. I love Function Health. I love Life Force. I love, Wild Health. Our competitors that are out there, I love them. I think they're doing good work because we need that out there. Do I think that we have advantages over them, that we're better than them? Yes. I wouldn't have worked with you all this time to build this product if we didn't think we were building something differentiated and better. But I think that they offer some value, just not the value that we offer, which is that complete personalized action plan, one-on-one time with a doctor, working with a coach for habit change, medications if you need it, guidance on supplements, exercise plans if you need it, nutrition plans if you need it. Like, so much included with the Bionic Health membership. I'm always saying that we charge too little for it, but people should take advantage while we charge what we do.
All right. Last question. And then if we didn't answer the question, you didn't answer the question that someone has, maybe we can talk a little bit about how people can submit questions. And if this episode is any good, if people like it, maybe think about doing this again. Last question. Career-wise, do you have advice for somebody entering the space of healthcare technology?
Yes. I'll give the practical answer. And second, I'll give what I feel. The practical answer is, if you're going into healthcare technology, if you're building something new, find dollars and follow those dollars. Most of healthcare cares about dollars. And so you go and you find, like, where is a health system losing money, and you put a patch on that, or you find, where could a healthcare organization make more money, and you help them make more money. So that is the logical answer that I give people. Now I'll give my feelings. We need you to help change healthcare for better outcomes for patients and better working conditions for our physicians, nurses, everybody in the healthcare industry. The healthcare industry is struggling. Like, the burnout epidemic for doctors and nurses is real, and we have to change it. And I think it's on all of us. Like, nobody's coming to our rescue. Nobody is going to save us from this problem. Like, we have to be the ones that dig in to make healthcare better and make it great for ourselves, for our families, for our patients, and for everybody else, the doctors, the patient, the nurses, everybody that's involved. So those are the two thoughts. And then you can decide, do you want to be a superhero and go save healthcare, or do you want to make money? And I mean, the nice thing would be to try to figure out how to do both. But yeah, that's the advice I'd give.
Sounds good. All right. Where can people submit questions, and maybe a little bit of wrap up to finish it up?
Yeah, so people can go to our website and they can hit our form and submit any questions to our podcast. They can also submit questions if they, Spotify has a comments, YouTube has a comments, so they can submit questions there. We do watch those, and we'll be happy to answer any of the questions they have. Thank you for listening to another episode of Medicine 3.0. We make this podcast so that you know where to turn for good information on keeping you and your loved ones healthy. Feel free to check us out at bionichealth.com, where we can help you live a longer, happier life.
Thanks so much for having me on. Really appreciate it. We'll talk to you guys next time.
Thanks, Justin.